Okay, I'm glad you're here. Ralph Havens, physical therapist, Beyond Limits Physical Therapy in Fairhaven, in Bellingham, Washington. And I'm going to show you the things we did to help runners solve chronic and mysterious conditions, things that were not being helped with successful surgeries, that yet the person still wasn't able to run, with all sorts of strengthening and stretching and the right kind of rest and kinesio tape and strapping and all these things done by very qualified, very good, skilled physical therapists, chiropractors, massage therapists, others. And the key is we need to find what's actually the root cause. Of course, what's the cause of this thing? And there's a very particular principle that we have in integrative manual therapy, the physical therapy that I practice, and it's that the body, your body, is protecting yourself from something. And it's very smart. Your body's very smart. I'm going to break down a few different examples and show you videos of runners and before and after session, because I'm at the interface between rehab, finding and fixing up these chronic conditions, and performance optimization. I have runners that I see on a regular basis to help them improve their running stride length and their power, and improve their stride frequency and get better performance out of them. It's what I do with my son, and it's what I do with others. So check out this next section. We're going to be going deep into how to find the root cause of chronic and mysterious conditions, especially running conditions, and to improve performance. All right, you guys, Ralph Havens here, Beyond Limits Physical Therapy. So running injuries, knee pain that's not resolving even with a quality surgery. I'm going to be showing you some examples of what we found over the years that has helped runners heal. I've got some examples of knee pain, one with a guy that was out for a year, over a year, runner, coach, young guy, and was unable to run for over a year. And he had had surgery, successful surgery according to the doctor. He had had lots of time off. He was very, very strong, very good with his exercises, his strengthening, his rehab, yet he couldn't run. And we solved it. I saw him one time, saw the root cause, which is the most important part, finding the primary root cause. I gave him some information and he went for it. He did it. And a week later, he was back to jogging a little bit, and then jogging a little bit more. And then he got all of his running back. Interestingly enough, lymph nodes that were chronically swollen also went away. And he said that he was no longer getting sick. He was no longer getting infections like he used to get. And he was back to running. So that's one guy. I'm going to give you a few examples and tell you how we did this and how you can do this if you're dealing with a chronic running injury. And this was a guy that had had a successful knee surgery and it didn't work. And then it did work once we got to the root causes. Some other athletes, I won't give very much identifying information to keep it private, but student athletes, runners that were out for entire seasons, some for over a year, and unable to run. One with a hip pain that was limiting them, couldn't run more than a minute, knee pain that was resisting all treatment, all rest, all strengthening, just couldn't get back to running. And both of those resolved. And again, it was finding the root cause, solving it with manual therapy techniques, things that we do, things that I do, and giving very specific, detailed information about how to change things in lifestyle that can resolve the primary root cause. So in those two cases, they did what I asked them to do. They came back a week later, and the person with hip pain no longer had hip pain and was back to jogging. And over the course of a few weeks, was back to jogging more and then doing some repetition intervals, and even got to run a few races at the end of the season. The other runner was did what I asked them to do and was better the second week, was a little better after that, and got some running back in his body, did some strides and some repetition running towards the end, ran some races and actually ran a PR. And he told me he couldn't have done it without me. He had been through lots of rest, lots of strengthening, lots of trying to fix it up. He loved running, but he couldn't run. The primary thing was to find the root cause. I'll give you two more examples and then tell you how to do this, if you like. So had a runner who also very good runner, student athlete runner, couldn't run for over a year. His stride was getting shorter and shorter. He had beautiful stride, but it wasn't what it used to look like when he was a kid. I saw a video of him when he was a kid, and you know, a middle schooler, but now he was past all that, much farther along in his academics, and he couldn't run. His coach was even advising him to just quit. He said, I can't help you, you can't train. We found the root cause. We worked on it. His was a groin issue and hip, groin, and lower abdominal issue. We solved that, and he did the recommended things, and he got his running back, actually got a PR that season, at the end of the season, in his signature event, so on the track. So, and then one more is me personally. Years ago, I'm a physical therapist. I was a physical therapist in San Diego, had a clinic, Mission Hills Physical Therapy, 5 therapists working for me, running 70, 80, sometimes 90 miles or more a week. And was a 228 marathoner. I was looking forward to running into my 40s and competing at that level. But then I was shut down, couldn't run, had a calf spasm that wouldn't go away. I had all my therapists work on me, or some of them therapists work on me. I went to classes, I got treatment from other people. I got 3 different pairs of orthotics and nothing worked. And I finally went to a therapist in Los Angeles who did what I now do, integrative manual therapy. And she found that the problem was in my chest, actually in the vessels of my chest, the vessels going into the heart, going out of the heart, the aorta. And sounds kind of crazy, but my body in its wisdom was protecting my aorta and my heart, smart body. And the result was it was spasming muscles in my leg. So all that work on the leg muscles, that wasn't where the problem was. But by finding the primary root cause for me, which was up here, we were able to solve it. So now that's what I do. I have a technique, a process called myofascial mapping, and we can find what's the cause. Of course, you want to find the cause of it, because what you're dealing with, if it's not going away, like a hip or a knee or a calf spasm or Achilles or a groin issue, if it's not going away, if you're doing all the right things, you're resting it, you've got the right dosage of training, you're getting a high quality physical therapy, strengthening, stretching, all the coordination drills. If it's not going away, you're probably looking in the wrong place. Kind of like me trying to fix a calf. The calf wasn't the problem. It was a totally normal calf. It was spasming to protect something up here. So in the case of those other runners, there was stuff in the pelvis. And we're talking about not joints and muscles. They did have joints and muscles that were problematic, but they were protecting some visceral structures, which is organs and other arteries and veins. And so finding the actual cause, and there's techniques to do in integrative manual therapy to heal it up, to fix it up, they were able to run again. And then changing a couple of things in their lifestyle, very, very important. Some of the nutrition pieces, very specific, and you can get your running back. So if you're chasing symptoms, if you're chasing problems, if you can't quite find how to get well, reach out to me, 360-599-2217. I'm right here in Fairhaven in Bellingham, Washington. And I can even talk to you over Zoom if you're far away. And we can find what's going on for you and help you find your root cause and get you on the track, back on the track and back on the trails and doing what you love, which is running. So I'm going to show you some things now of some before and after examples, because when I'm the interface between rehab, which is what we just talked about, healing the physical body, and performance, optimizing the stride frequency, the stride length, the power, optimizing performance. And for my boy, I'm going to show you a video of him running. We've optimized his stride. He's got a beautiful stride. People talk about how it looks like he's just got this big stride that's like spinning, because he is. So I'll show you how the result of what can happen. And I'm going to show you pre and post running of one of our athletes who, different than the ones we just talked about, who had a left hip problem, and what her result was before and after. So, so let me get this all ready for us. I'm going to show you first the clinic, Ralph Havens Physical Therapy, Beyond Limits Physical Therapy in Bellingham, Washington, 1134 10th Street, right by the Village Green. We do treat chronic pain, running and sports injuries, and autoimmune conditions, because a lot of times those are linked. All right, so the next level is about performance, about stride optimization, performance, running faster, making things better. You know, if you're still dealing with an injury, then of course we need to do the rehab. We need to find the primary root cause, like we just talked about, and get right to it. If you're here watching this, you've probably already got a great coach, got a great system, have taken the rest, doing all the right exercises, maybe seen other physical therapists and chiros and massage therapists, and yet it's just not working. And so we have to find the root cause. So that's what we just talked about. And if you want to do this, now is a good time. There'll be links to contact me. What I want to show you now is the next level, which is performance. So if you're looking for performance, here's some things. So I'm going to show you a video of my son running. He was running a time trial before he was in the 6th grade. So it was the summer before 6th grade. He wanted to test himself, and his buddy, great local runner, paced him through a time trial. I'm going to show you his stride so that you can get a sense of how that moves, how he moves once we optimize stride. So, right, so I'm going to show you Ben and his running form. This was him before the 6th grade, and he was getting paced by his buddy. Really great runner, local runner. And there's Ben with the long hair, and you can just notice his stride. As we optimize performance, we get that nice wide open stride, the paw back. It's beautiful. Finding and clearing the root causes of anything that's in the way of a wide open, powerful stride. And I'm going to show you one more of Ben. This is at the end of a race that he was winning. And you can see his stride here. Big, wide open stride with performance optimization. And then one more. This was Hannah B, who came to see us. She had a left hip that was tight. And so we did a 2-hour session optimizing performance, improving the function, taking away root causes in her left hip and spine and pelvis. This was her before picture video. And she's got pretty good form, right? She's going up and down a little bit. Her ponytail is moving to the left and not to the right because she's rotating to the right in her upper back, but she can't rotate to the left because of the tight left hip. Notice how her feet hit the ground and the power that she has. Now, after a 2-hour session, here's what happened. So notice the power in the stride. Notice how her feet hit the ground differently. She's pawing back. Her ponytail is swinging to both sides because she's rotating, and her left hip quit being tight. Her speed work got better, she reported. So this is a good example of from rehab to optimization. We helped her with her left hip, and then improved her performance. So reach out to me if this speaks to you. If you're a runner, if you're in Fairhaven in Bellingham, Washington, we're at the corner of Mill Avenue and 10th Street, 1134 10th Street, Beyond Limits Physical Therapy. The number is 360-599-2217. My website is ralphhavens.com. Reach out to me. And if you're not local, reach out to me and we can meet over Zoom, and I can show you what I see that's going on with you and point you to things that can work to help your healing, get you back on track, back on the trails, and running the way you want to run. So Ralph Havens here, signing off from Fairhaven, Washington.